From WisPolitics in Madison, you're listening to Capital Chats.
Hello, everyone. My name is Abigail Evans, and I'm here with another WisPolitics Capital Chats podcast brought to you by Spectrum. I'm in the office ready to talk about an interview I did with Wisconsin Medicaid Director Bill Hanna. We talked about the reconciliation bill and the impact it will have on Wisconsinites. Let's get to the interview. Thanks again for being on the podcast, Bill. I want to start by asking you about your background. How long have you been at DHS and how long have you been Medicaid Director?
This is my second time at DHS. I was here from 2013 to 2016, and I came back because I love it so much. I have been the director about coming up on 18 months now.
Sure. And well, the big thing I want to talk to you about today, Bill, is the reconciliation bill, which everyone is talking about how it's going to impact Medicaid in Wisconsin. And I want to talk to you about some of the basic facts of what you're seeing coming down from what they're doing on the federal level. But let's start with, do you have any analysis of how this is going to impact Wisconsin on a broad level? How many people are there people that could lose coverage and what counties will be most affected? So you can start broad and kind of get specific.
Sure. So let's just talk very broad about how broad Medicaid is. It covers about 1 in 5 people in our state. That's urban and rural. It goes by a lot of different names in Wisconsin. It's sometimes called Badger Care or Family Care or Iris, but all of those are sort of some program of Medicaid. The biggest impact that we see from the federal bill will impact adults on our program. As many folks know, Wisconsin didn't do the full Medicaid expansion, but we've done sort of the Wisconsin model of covering adults up to 100% of the federal poverty. And there are a lot of provisions in the federal bill that are focused on the expansion population. And again, while we didn't do the full expansion, we are included in many of those provisions of the bill that will see the biggest impact. So we're talking about adults between the ages of 19 and 64 who do not have dependent children. They will be subject to 2 new provisions that will go live December 31st of 2026. The first is this specific population will have to renew their eligibility at least every 6 months. Currently, it needs to be renewed once a year. That's not to say that we don't do verification checks throughout the year, or people do not report, they report changes, right, to their income during the year. But they will have to go through the full redetermination process at least every 6 months. The other provision is that this population will be subject to proving that they are working or meeting working requirements, either being employed, volunteering, or education at least 80 hours a month, and sending in documentation to the department that they are meeting those expectations. We expect about 63,000 individuals will get caught up in this new red tape of proving that they are eligible and could potentially lose their Medicaid eligibility because of these new requirements. That's where we're seeing the biggest impact to individuals on the program.
And how would having to increase these eligibility checks, how would that impact your department? Are you looking at a larger workload, larger cost for you guys having to go through this process extensively more often?
Absolutely. And it's not just the department. In Wisconsin, counties do the eligibility work. The department does the eligibility work in Milwaukee, but you're essentially doubling the workload, right? For the roughly 195,000 individuals that are in this population, because they're going to have, a worker's going to have to touch their case twice a year, as well as we have to explain to each individual that is subject to the work requirements what those are, and do all the document verification to those for each of those renewals. So we expect that to cost us in the first year, really, probably about $8 million state funding, and that number will grow over time, because that's really, we're just looking at what will it cost us over the next state budget, knowing that these new policies really don't go into effect until the very end of the next state budget. I think the biggest piece as well is we offer an employment and training program in food share, which already has a work requirement. And if we build a similar model for individuals so that they can do employment and training services to get a job, that will be a significant increase in a new program to serve this population.
All right, and that $8 million, is that just added because of the eligibility check requirement, or is that overall? What's the overall number for how much you think this would cost the state?
So that's the eligibility, that's the work requirement effort that's required. And that's also some of the system changes that are required in the bill. There's new data exchanges that we have to establish. Obviously, there's other system work we have to do in order to collect all the work requirement data and validation and documentation. So really those provisions altogether is about $8 million GPR.
And going back to the work requirements, that's something that Governor Scott Walker tried to implement but didn't after COVID. And I think Tommy Thompson had it in the 1990s, but it's been a while. Tell me about how that would impact Medicaid. Is it going to make people work more? Is it going to not have much of an impact? What do you know about that?
I think we've seen this, right? There were two states that really tried this in prior years, got it off the ground. That was Arkansas and Georgia. And it didn't really prove out actually increasing work participation. In fact, there was a recent Congressional Budget Office report that showed it doesn't really change employment numbers. I think that's part of the reason in Wisconsin, we think it's important that we have an actual employment and training program that's not funded by the feds, but something Wisconsin has long done in the food share space and would think would be critical if we actually want to see positive outcomes. Otherwise, the federal regulations are really just more red tape and make it harder for people to maintain their coverage. I will point out that fewer people impacts everybody in Wisconsin, because it's not like these individuals all of a sudden don't need health care, right? So just because they don't need health, just because they're not insured under Medicaid doesn't mean they won't go to the doctor or won't go to the hospital if there's an accident. They just don't have insurance, right? Which means providers have to bear the cost to care for these individuals, and that cost gets passed on to all healthcare consumers. So it's important that all Wisconsinites understand what these changes do to the healthcare ecosystem, not just to the 63,000 individuals we're estimating that are currently on the program. This will have ripple effects across the healthcare system.
Okay, on that, I wanted to ask, what is the biggest drivers of Medicaid costs? So who's really going to be feeling this? Because you mentioned the providers, you mentioned the people who are relying on the insurance, you mentioned also the departments and the counties. What's kind of the biggest driver here of the costs and why they're going to go up?
Well, so these are not necessarily costs to the state, right?
Mhm.
The costs come to providers who, if you have somebody who's on Medicaid today and then they're no longer eligible or can't meet the work requirements, and they end up having to go to the hospital still needs to care for that person. Now we're talking about people who live in poverty, so they don't have, right, the income to pay that medical bill. That means hospitals have less revenue, which means they have to find that revenue somewhere else, which means it's going to get passed on to all of us, right? For increased costs and increased insurance costs for us to fill that uncompensated care. It also increases medical debt, right? Medical debt for that individual. And again, we're talking about people who are living below the poverty line already, which just adds more court costs, right? There's a lot of externalities and additional costs that other systems bear when people lose their health insurance.
And you mentioned people below the poverty level receiving Medicaid. Tell me, this has also been a big conversation, obviously debate between Democrats and Republicans, because we have Ron Johnson saying it's only single able-bodied adults who are on Medicaid and these people should be off, which is why we need the work requirement. But then we have Representative Pocan saying, no, there's all these people who need it. Tell me, what's the typical Medicaid recipient in Wisconsin?
Well, so typical Medicaid individual in Wisconsin is hard to define because it's a broad ranging program, right? So I
Sure.
mentioned at the top, you have Family Care and Iris, which serves individuals with disabilities or older folks. That's actually where we spend. It's sort of a smaller number of people, but it's actually where we spend more of our Medicaid dollars because of what it does is it allows people to live in the community rather than in a nursing home, right? And in Wisconsin, unlike many other states, we don't have a waiting list for that population. We have really invested in the most vulnerable, right? This includes kids and adults, no waiting lists. And that has been a bipartisan effort in Wisconsin. You can go back to Tommy Thompson through Governor Evers finally eliminating the wait list. So it's hard when you compare Wisconsin to the rest of the country because Wisconsin has really invested in its population and done the right thing. I will say, comparing us to other states, one piece of the bill that's really Wisconsin is getting punished for is how we use provider taxes to fund our Medicaid system. In many other states, they tax a provider up to the max, which is 6% of their revenue. And then they collect the federal dollar and they pay the provider increased rates. We have not done that in Wisconsin. Our hospital provider tax right now is less than 2%. And what the bill does is it freezes us out of making any changes. So it's really hard, right, when you have this national conversation about who is and who isn't Medicaid, and then to have this local conversation on how Wisconsin has for a long time been different than so many states. You can talk about how we were one of the first to do home and community-based waivers like family care and eliminating our waiting list to Wisconsin's own separate pathway to expansion. We're really hard to compare and then to have sort of that national conversation.
Sure. Do you have a sense of who's going to be the most impacted by if this passes?
If this passes, the individual, it'll certainly be that 19 to 64-year-old that is under 100% of the federal poverty level.
Sure. And assuming like if this bill passes, what do you anticipate being the most immediate effects? Will people not see anything till the end of next year or the next budget, or will we be feeling it right away?
I think from a Medicaid perspective, people will start, because we'll have to start getting the communication out in early to mid 2026 so that people are aware of the new requirements that they will need to meet in order to maintain their eligibility, and then would expect sort of these new eligibility checks to be starting the very beginning of 2027. So I think the immediate impact, sort of actual losing coverage, will be in 27, but certainly the anxiety and the messaging will have to happen well in advance of that to make sure people are prepared.
Got it. And that's the big questions I had for you today, Bill. I'm wondering if there's anything else you want to add you think people should know about this.
I would just go back to reminding folks that Medicaid goes by many names in Wisconsin, and so that and that it's not just going to impact sort of these individuals that meet the expansion requirement. That this is a disruption to the healthcare ecosystem, not only in Wisconsin but across the country.
Yeah. Well, thank you so much for your time, Bill. I really appreciate you chatting with me.
Thank you.
Thanks for listening to that interview. If you want to learn more about how federal policies are impacting Wisconsinites, you can sign up for our DC Wrap newsletter every week at wispolitics.com. For now, I'm Abigail Levins, and this was another WisPolitics Capital Chats brought to you by Spectrum.